Hi, it's Anna-Kaisa with the 4th episode of Life of DI, and this is Chloe the cat. This rotation was in the Mission Bay Hospital, which is a new hospital at the bay side of the city. Here I had patients who have had surgical oncology.
She's sharpening her claws.
I know that. Hi, it's Anna-Kaisa with the 4th episode of Life of DI, Surgical Oncology and Obstetrics. This rotation took place at the Mission Bay Hospital, which is a brand new hospital at the east side or the bay side of the city. And it's a new hospital, which means that it's nice and spacious, it's airy, there's plenty of places to work, and they also have tugs. These are robots that take food from the kitchen to the patients, and I don't know why they're so fun, but it's really fun to look at them open doors for themselves and call the elevator and such, so it's kind of fun to hear them beeping on the floors. The Mission Bay Hospital has only one RD for the whole adult side of the hospital, which means that as an intern in this rotation, I would see all these kinds of patients that come to Mission Bay. There are pregnant women, but also patients who have had a surgery because of cancer. So they might have surgery of the head and neck, or a gastrectomy, maybe a pancreatectomy, or a colectomy with an ileostomy. And so all of these patients have different needs. So this means that I have to provide them with different things, and this also means that it took me longer to get used to the patient population than it did with the previous rotations, because every day I would have a different kind of patient, a new kind of patient to work with, and at the first time with anything, it takes a little bit longer to really know what to do. But luckily, the second time I had the similar kind of patient, it took me a lot less time, and it really proved to me that practice is the best way to learn. For example, I had a gestational diabetic patient, and with this patient, my preceptor just told me to work with it and go see the patient alone, and it was really a good challenge because I haven't really had a patient with diabetes in this internship before. So it took me a really long time to get ready for the patient, and also I felt pretty nervous going in, pretty uncomfortable going in to see the patient. But I think that being uncomfortable is not a bad thing. It's only going to make me a better professional when I can deal with patients even when I feel uncomfortable. So that was a great learning experience for me. Another challenging patient was someone with surgery of the head and neck. And so they also had a tracheostomy, which means that they can't be speaking when I interview them. So all my questions have to be something that they can just nod their head or say no this way, maybe show numbers with their fingers. He also could write a little bit on a little notepad, but it was really hard to understand what they were saying because somehow their arm it was hard for him to write. So it took me forever to see this patient, and I'm glad that this patient had patience with me because it was really difficult, but I made it, and I got all the information I needed. Also, what I noticed with one patient is that sometimes they don't want to see anyone from nutrition. Maybe these patients are already really set in their ways. They don't want anyone to tell them what to do. And so it's really important that you read patients and see see their body language and see if they want to talk to you or not, because then you can respond to them at that level. So I caught this attitude really early with one patient, and when I turned it into a joke, I had a really good conversation with this patient afterwards. So that's a good skill to have and a good skill to develop when you're working with patients. I also noticed that sometimes patients don't really understand what nutrition has to do with their care. So because of this, it's good to know your AIDED. So it's an acronym that means acknowledge, introduce, duration, explain, and thank you. So when you come in with this introduction, patient knows exactly what you are there to do, and you have a much better time getting information and also giving education to the patient. So this is also what I really learned actually all throughout the internship so far. And so last time I was talking about something that I wanted to work on, which was getting faster with writing notes. And I definitely was working on this also in this rotation. Of course, it took me longer to work on that because I had a new kind of patient so often. But I noticed also that having that goal in mind to get faster, I was also stressing myself out, and that was not necessarily always good. But, you know, slowly I was making a little bit of progress. I also really noticed that I'm very self-critical and too much, so even my preceptor was telling me to relax and not take it so seriously, and I've been doing really well actually, but I still expect myself to be perfect, and that's not really how it's going to be at an internship. So I really realized that I got to relax a little bit more. I'm doing just fine. I'm right where I'm supposed to be at this time of the internship. Next, I will be going into the management rotation, which will also be at Mission Bay, and this is a 8-week rotation where we have different kinds of projects relating to patient food services, and so it's going to be very different from what I've been doing so far in the clinical rotations, but I look forward to that and to see how we feed the patients and what needs to happen behind the curtain in the kitchen. If you have any comments or questions, leave them below, and I look forward to seeing you in a few weeks. Thank you. Bye.
I never say no to a treat.